Hi, I am so honored, humbled, and flabbergasted that I received this prestigious Florence Nightingale Award. I was speechless when Dean Marcia Hearn called me to inform me of this award. I want to thank Vicki Miracle and Jenny Sims for writing their essay for my nomination. I've known Vicki since she graduated in 1975 when we worked together in the Norton CCU and then on the American Heart Association Cardiovascular Planning Committee where I met Jenny Sims. They both have done very well in their fields, and I respect them highly. I want to thank the board, University of Louisville, and the dean for bestowing this great honor. I also want to thank my sister, who's been a pediatric oncology nurse since 1976 and was recently honored on WHAS as a very caring, compassionate nurse for 40-plus years. She is one of the most patient and kind nurses, mother, and grandmother that I've ever met. She is one who really deserves this award as well and will be accepting my award. Lastly, I want to thank all of my previous coworkers, bosses, and patients throughout my nursing career. I credit my mentors Marlette Wigington and Jean Conrad, who helped mold me. Looking back, I first wanted to be a dancer, then a stewardess, and then a nurse. Dancing is one of my passions, but I knew it wasn't going to pay my bills or allow me to eat and travel. And for those that know me, I love to eat and travel. I've been on 64 cruises. 65 is coming up during this banquet. Being only 5'3" disqualified me as a stewardess because at that time you had to be 5'5". Then I thought about my wonderful grandmother, my Nana, and wondered how much my mother cared for her and my grandfather at our home after her numerous strokes. My mother worked hard and was amazing with my grandparents. I truly believe she inspired me to become a nurse. Plus, I watched a lot of medical TV shows, which made me realize I wanted to do something that was meaningful and caring. So I applied to Norton Memorial School of Nursing, and the rest is history. Initially, I thought I wanted to be a surgical nurse, but I eventually decided that wasn't for me. One night as a PCI, I was pulled to the ICU, and I was terrified. One of the nurses commented how good I was with patients and willing to learn. She kept mentioning, "You need to come back and work in the ICU." I told her she was crazy, but I kept coming back, and I knew this is where I belonged and where I thrived. My goal was to become the best critical care nurse that I could be. I joined S.C.R.N and attended as many nursing conferences that I could. I came certified as a C.C.R.N and an S.C.R.N. I love the invasive lines, hemodynamics, titrating vasoactive drips, intrarate balloon pumps, Impella, left ventricular assist device, and continuous renal replacement therapy. I worked while obtaining my B.S.N at the U of L. I worked as a bedside nurse, clinical instructor, cardiology clinician, nurse educator, and nurse manager. But I realized that teaching and training was the best fit for me, so the next step was going back for my M.S.N. I'm proudly to say I earned a 3.8 GPA. Critical care nursing is still my #1 passion and forte, and I cannot express how honored I am to be a Florence Nightingale awardee. Thank you so very much.